test the live.
Okay, now I will get this all situated here.
Okay.
Okay, I'm just gonna test the sound. Oh, sure. Oh, sure. Everyone's muted.
Hello? How's everyone?
Good.
Good.
Does the sound seem okay, Katie?
It does now, yeah.
Okay.
I think we're good.
And I'm trying an experiment this time. I seem to be the source of interference on the
How's everyone?
audio sometimes. And Sandra came up with the idea that it might be my hearing aids. So they're gone. It's a Bluetooth hearing aid.
Oh, it does now, yeah.
Okay. And I'll mute again
We're
for the
good.
whole meeting if I need to.
Well, it's interesting because we had you muted and it was still having the feedback sound that I don't think was yours.
I'm
So
trying an experiment this time.
we had everyone muted.
I seem to be
And
the source of
oops, sorry. And so I'm not really sure how that
Yeah, I don't know. I moved them to I moved the hearing aids to another room. I don't need them to do this anyway. And just in case they were Bluetooth on the hearing aids was part of the interference, but
yeah.
I can mute.
And then we'll know it's not you if it happens again. It wasn't your hearing aid. So good test. Well, thank you for trying to problem solve.
Are we live?
Yes,
Katie?
we are live. The sound
I
is
thought we
working.
probably were because that's why it was so quiet.
Hello, everyone.
Hi, Angie.
Hello, Angie.
Hi, Angie.
I'm glad you can all hear me. Glad to see you. I sure like Cheryl Floyd. I wish I was where she was right now.
And where is,
Me too.
Ron's
How-
changing his.
I wish I were there too. It's Myrtle Beach, South Carolina.
I'm disappointed. I thought you were there.
Oh, it's the opposite of your igloo back there.
Everyone doing well today?
Oh, yeah.
Doing well.
Yes.
We went up to the cabin last weekend and opened it up. Sunday, beautiful, 54 and sunny. Monday, when we left, there was snow.
Yes. How
Well,
about that?
you know, in case you forgot, Lucy, after every year that you lived here,
I know.
just in case.
How many Easters have we all had pictures where we've had snow in the background and
Oh, yeah.
winter coats on?
No, I remind myself, my birthday is the 12th of April, and I remind myself that my mother used to tell the story of being afraid she wouldn't get to the hospital because there was a blizzard.
About right.
So, you know,
Right. And I've been out in the snow in May, so.
Yeah, me
And
too.
I never put my boots away
No,
until
mine is,
after
Never
Mother's
wash
Day.
your coat or any of this until
No.
at least July.
That's right.
But we had taken the snow scraper out of the car, so I had to get a spatula to try to scrape the windows off.
How did
Leave it
that
to-
work?
It worked pretty good. It had a long handle on it, so it worked pretty good.
Good.
I always laugh. This is the swag that the University of Illinois gives out up in this region, which is an ice scraper. You know, and I always laughed. I thought, you know, in Chicago, we don't get these kind of things. They usually have a key ring or something. But here, this is the swag they give us. An ice scraper.
That's not bad.
Very
Appropriate.
handy. It's also a bottle opener on the side. There you go.
Multi-purpose.
A bottle opener.
I like that. If you can't scrape it off, drink it.
Sandra, I must say, the College of Nursing could not give out bottle openers, regardless of how handy you and I might think they are, because it would not be health promoting.
Well, you know, but I might be using it to open the can of heat that goes in the car.
Ah.
So there you go.
Would that be acceptable to the College of Nursing?
Yeah, it would be okay then.
All right, I guess we have a quorum. Thank you, Christine. I saw your message. If you hear any banging or noise in the background, I apologize. They finally got around to doing my roof from last year, and I thought they would be done by now, but apparently not. But it's getting done, so I'm happy. Okay, looking at our agenda, do we have any guests?
No guess. No guess.
Excellent, excellent. Then we need approval of the agenda for April 20th, 2021.
So move.
Second.
Excellent. All in favor?
Aye.
Aye.
Any opposed? Excellent. Peruse the minutes from March 16th, 2021. I didn't see anything that needed to be changed. We need approval of minutes.
So moved.
Second.
Second. Excellent. Any discussion? All in favor?
Aye.
Aye.
Excellent. Any opposed? Presentation on the COVID-19 local perspective update.
Good evening, everyone. Happy return to winter. I am going to give us our monthly update. I apologize, it was not in your packet. Is everyone able to see the slides?
Yes.
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 Good, 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 good. So as usual, we always kind of start with, the reality is I'm reporting in mid-April, but I'm reporting on primarily March data up through March. And we've really seen a larger increase in April, but it began to show in March. And so on some of the slides, we'll sort of see the beginning of the increase in March, but unfortunately, we know we're in the heat of what is now our third wave. Right now, we are just over 29,000 cases. And at the bottom of the triangle, you see the 123,000 vaccine doses. We've really administered at this point closer to 164,000. So that has increased significantly. Just a trending slide. Again, I've used this the last couple of months to give a good overview. I know we'll share this deck after the meeting tonight, and so you can review these at your leisure. I will be skipping through a number of these. The only thing I want to call out on this is sort of our overview that pulls data off of COVID Act Now, which is a good national site that provides status on every state, and you can drill down to the county level. In terms of the infection rate, you see there's a red arrow to the right-hand side showing that has increased significantly. And again, across the state, we've seen that increase, and in a number of states around the country, we've seen that increase with this new surge coming through. I'm going to skip this slide, and then the only thing I want to call out on this lab testing volume slide is to really note those blue bars are the number of tests that are being the testing volume here in Winnebago County, and overall it has a downward slope. We've been declining every month in testing volume since November. In November, we peaked at like 52,000 tests over the course of November, and it's just been dropping steadily since then. One of the things that happens, though, since when we calculate positivity, it's the number of positive results over the total number of tests. So as the testing volume goes down, that can influence the positivity rate somewhat. But we're definitely seeing, we're seeing so many more cases. We are seeing those increases in positivity rate. And it's not just because the base is declining. This is, again, a summary slide. The only thing I want to, the last bullet on there that sort of says third wave beginning. Well, it has begun. This cumulative slide, you can sort of see right at the very top of it, which is the most recent data for this. You see that peak just starting, and similarly down here on our cases by date of illness, we start to see the very beginning of this. When you see these charts next month, you'll see much more clearly that we are in the midst of this next wave of cases. This is a new slide that we wanted to add for you this month. This comes out of our Salesforce tracking data, and it allows us to monitor the variants that are showing up in the area. This was done a couple, at least a week ago. And it was showing that we had 11 variant cases identified in Winnebago County so far. 10 out of those 11 were the B17 variant coming out of England, and one was the P1, which I believe is the Brazilian or South American variant. I know that as of today, those numbers have increased. And again, we'll keep you apprised of that. And clearly those changes in the variants are helping to influence the spread of the cases throughout the country. Positivity rate, again, the only thing, we've seen this slide before. There was the decline through the summer. We ramped up, the rates really got high in November. They fell steadily, and then in March, it ticked up again, and it moved up just a little bit from 3.3% to 3.7%. At the end of March. We're now running on we're now running well above that this month. And this is, again, this was a slide where we're sort of tracking that rolling 7-day positivity rate. There were a series of interventions as the state tightened up the for mitigation as things had peaked. And then as things improved, the mitigation sort of backed off. In earlier months, you've seen was these mitigations all over the place showing when they occurred. The last move to phase 4 was right around here in January. The rates continued to decline, and we were seeing a low 5% positivity rate on a rolling average. We are now moving upwards, and as of today, we are at 8.4% as a rolling 7-day positivity rate, reflecting the increases we've seen these last few weeks. We're now coming into that section of the slide deck, and I'm going to skip through a number of these, but really sort of describe the cases in terms of age, gender, race, and ethnicity. Most of that has not significantly changed. So if we look at sort of the age distribution of the cases, going from the beginning of the pandemic to right now, those sort of total averages by age bands hadn't really shifted that much as of the end of March. But as we'll see on the next slide, when we really look at when this was run at the beginning of April, we start to see the shifts in the age distribution. We see a real increase in both in the 20 to 29 and the 30 to 39 age bands where that red circle is, and then compression at the upper ages where we see fewer cases, particularly at the 65 plus. And so that reduction at the upper ages may in fact reflect the impact of vaccinations, as we're getting a lot of that population vaccinated and we're seeing fewer cases there, but it's also showing how those young working age adults are really increasing significantly.
And Peter, the young, that group of 20 to 29-year-olds also had the highest rate of variant.
Yes.
From the first line, yeah.
Yes. Yeah, that's where, again, in that 20 to 29 and 30 to 39, those younger working age, that's where those variants are showing up in the community and the population. I'm going to skip the next few slides. Really, we've seen these every month, and month over month, we're not seeing much of a change in these distributions in terms of race and ethnicity, the case rates, the distribution by age and gender. These have been really pretty stable right through. Deaths by race and ethnicity has not really shifted at this point. So now let's talk about what's going on with our hospitals a little bit. That top chart, you've seen this information before, but that top chart is, again, a new chart that we've added. This is showing total COVID patients in the 3 hospitals here, in 3 hospital systems here in Winnebago. The various bars represent each of the different hospitals, the number of COVID patients, whether they're in the ICU or not. It's the total patients, including any who may be on ventilators. And then the green line is showing the cumulative total across all the hospitals. That one big dip is only because that was there was no data reported for that day, so there was a big drop off. It doesn't mean people were all discharged and then readmitted. But you can see that sort of the slope, and there's a trend line in there, so you can see the slope upward, and that again has continued into this month. Similarly, on admissions and ICU use, that new circle, that's showing the beginning of this third wave starting up to show more admissions. They've been coming down, starting to come up a little bit. And on the ICU, again, the capacity, the available beds in those ICUs starting to drop. Now this month, we're below the 20% threshold, and that's at the regional level. And that's a challenge as well. We've talked about the communities of concern before and their case rates. Again, we see just a little bit of movement. That's a pretty stable group in terms of where the cases continue to be. Looking at the schools, again, this is the March data. And so in terms of cases reported in the schools, this was the big ramp up in the fall, the schools went remote, the numbers were dropping. We showed that real decline, and then it starts to tick up just a little bit in March. And again, when we share this information with the April data, there'll be a continued uptick in that data, which hopefully won't go on for too long, but we are seeing that now in terms of cases in the schools. Here's our vaccination numbers overall summary from, this is how it's reported out on the IDPH website. So our total number of cases of vaccines, as I mentioned earlier, were around 164,000. Almost 70,000 people are fully vaccinated, and that represents almost 25% of the county population. And the other thing I want to just sort of point out is sort of this last bullet. Breakthrough cases are defined as those cases where someone who has been fully vaccinated, so it's at least 2 weeks after their second vaccination in the case of Moderna or Pfizer, or 2 weeks after the Johnson & Johnson vaccination, they're considered fully vaccinated. And then they're looking to see, are there breakthrough cases, people who are diagnosed with COVID, to understand that. And we track those potential cases, those are identified through the providers. And then we work with the state in terms of collecting data and providing that through. So that is something that we do actively monitor. In terms of the cases in congregate settings, this was largely stable through March. We're seeing a few outbreaks in a few settings this month, and again, we'll reflect that in the data next month. But up through March, this was all staying very stable. Similarly, this is largely unchanged in terms of deaths, and the number of deaths this past month was low. No changes relative to deaths and comorbidities that were associated. Usually there's a little movement. This month, basically all those percentages stayed the same, really because there were thankfully so few deaths. And then again, no changes in terms of the mix of where people were being exposed. No change in the mix or even in the order of those comorbidities associated with the cases. And then I guess the last thing I'll share is just off of the, again, the IDPH website, where they're monitoring county by county and showing what the risk status is. At the end of March, we were a blue county. We only had one indicator that was over the warning, which was our new case rate. In February, we had no indicators, but in March we had the one, and with the latest update, we're now running with multiple indicators because of the increase in terms of case rate, in terms of our positivity rate, and in terms of hospital utilization. That's really the overview for COVID for the month of March, with some sense of what's occurring right now. Thank you.
Thank you. I have a quick question. So what's going on with the progress of vaccinating that group 20 to 29 and 30 to 39? I know we've done a really good job, I think, of vaccinating in the community, the people 65 and older, and I know we've opened it up to everyone, but how is that going between the three systems, Crusader, and I believe the local pharmacies as well, along with the Board of Health?
I don't have the specific data on that right now. I'd be happy to go back and pull some data through to drill down really to that, but Dr. Martel, I know, can speak to this.
Well, and I think we had some discussion earlier because we were looking at, so first of all, if you're talking about efforts and strategy, first of all, we've been doing vaccination events at the schools with the idea of, last week we did some work we were at Auburn, Jefferson, Riza. Unfortunately, I want to say that the numbers, we would hope to get higher numbers, but we had capacity for 1,000 on the weekend clinics. Auburn and Jefferson were Saturday and Sunday. Riza and I forget the first one we started at. Guilford, we had availability for 500, and we were under target on every single one of those with the schools doing outreach. We also, so we're targeting that. This is university. Well, we made ours university week, not just university day, so that we have preferred appointments for anyone from college, that college age group. So we're doing some specific and targeted outreach on that. When you look at overall vaccination rates, if you add in our 16 and above, we're at about 22%. Overall vaccination rates. Peter just looked at this yesterday with me, and 23% for 18 and over. But we're really going to have to do a next move on this group. And whether that's, we just had kind of some strategy discussions, whether we have, dance night. We're looking at all different kinds of things to bring in that particular group. I think it'll be a challenge because they are the ones with variants right now. And it could be that the latest population vaccinated, which could be an artificial kind of situation. But if you think about it, the overall population rate is 25% right now of our community's been vaccinated. There, 1 out of 4 of us is sitting at a table. The other 3 are potential variant carriers because it has an opportunity to jump to all 3. And this is a group that went on spring break. This is a group that had a hard time. So when you look at, spring break from the college, many of the universities shut that down, but then kids went anyway because they could remote learn from their spring break locations. This is an age of, as we know, invincible, that you don't have that long look ahead of you. So it's going to create, we're going to have to do some more work on this to bring that particular population into some kind of vaccination. We've offered it at workplaces. That's another challenge. Uptake in general is kind of low right now throughout the entire state. And I was just reading some stuff that came in. Iowa turned back most of their doses this month for vaccination because of a lack of demand. I think we have to really, focus on this population in some way, shape, or form. And you laugh. I thought of, we do 6 to 8. I know that Budweiser has a campaign right now. I hate to say it, where that you can, if you produce your vaccine sticker or proof that you've been vaccinated, they will give you a voucher for a free beer. I'm not sure about that, but okay. Then Miller did something. They created some cool t-shirts where there was a sleeveless, 1 sleeve off t-shirt to show off your vaccination arms. But I think we're all trying to look at different ways to bring this population. And we've talked about doing, and Laf, I saw when you're on Zoom, sometimes someone's got a big phone in the center right now, I guess, whatever display I've got. But Laf and I've are looking at maybe some kind of a referral system, bring a friend, get a card, do a drawing every hour for, some kind of item, whether it's a gift card to Starbucks for the population or pizza delivery or something, whatever we can do to incentivize this group to get vaccinated, because right now, by chance or by choice, they're the variant carrying group. And they are also right now in the largest, spreading group. So very difficult right now to get that group. And first of all, every single one of our systems can vaccinate that population. They too are suffering from that same part. I would think Swedish American shared with us some of their challenges and trying to get these folks in because they typically don't come in for health services, right?
Right.
Healthy age, right? What are you coming in for? Hopefully you're not diabetic or hypertensive and needing that. So we've got to get them where they typically go. And, facetiously, we've kind of talked a little bit about maybe some outreach along some of our more famous night places, or whether you have a sports night where you vaccinate. But again, you've got to still keep them out of those big group settings. So we have that challenge, right? Other techniques that we've used for other kinds of events, we can't do as well. So we're going to have to continue on this challenge and trying to get that done. If anyone has any creative ideas, I know we've talked about, Rebecca's talked about doing some kind of a survey to find out what would bring people in to vaccinate or not vaccinate. I think when colleges start requiring it and travel starts to requirement in some of these social venues, such as sporting events or concert tickets, any of that kind of thing would require you to be vaccinated, I think that's when you'll start people vaccinating, really not because they're concerned about their health, but they want to participate in the activity.
Well, that's my concern because, yes, they're younger. Yes, they're the college age. Yes, they're going to spring break. But I think the problem we see with the variant, the biggest problem is that, especially in that 30 to 39 age group, those are people who have kids that may be in third, fourth, fifth grade. And from a person who personally did this, the travel with AAU sports throughout the entire Midwest is going to be an issue. And that's my concern, that 30 to 39 and 40 to 49 age group are the parents of the kids in the basketball tournaments that are in Michigan, Indiana, Wisconsin, Kansas City, Chicago. And just looking at Facebook and posts, people are participating in these travel tournaments with their kids. So I was just wondering what we've done. I mean, I know what the hospital's trying to do and social media and things of that nature, but it is a rough group. And I hate to say, I think you're right, that unless these venues require people 16 and over to show proof of vaccinations, I don't know how we're going to get the young and invulnerable groups to do it.
Yeah.
But
And again, our 16 to 18, which we did in the schools, part of the encouragement was many of them wanted to play their sports. And it was interesting to talk, I mean, as you would guess, watching 16-year-old and 18-year-old sit with their parents in the 15-minute penalty box, as to see them interacting, you know, just kind of find out why they're vaccinating, why they're not. Most of them, I have to admit, in that group wanted to say, I wanted to see my friends. I want to play, you know, I want to go, you know, hang out with my, you know, summer. I want to be able to do some sports. Several of our sports teams at the high school level have been impacted by quarantine in the last month. And so you know, but I think it's also then incentivizing in some way, getting that next lift group. We've gotten what we call the low hanging fruit, and the group that wanted to be vaccinated, understood the risk, were most at risk, and they actually got vaccinated. Now we're, you know, like most of us, we have to do a much larger reach and outreach to get individuals that they're not even vaccine hesitant. They just vaccine and, you know, is not on their radar right now, to get them into the next grouping. In addition to our vaccine hesitant crowd, right? So pulling them in. We've also, despite the fact that Johnson & Johnson and Janssen COVID-19, you know, vaccine was really in pause situation, and there was concern that people may not want it, we're finding people are requesting it. There's still I'm going to say a market, if the vaccine is determined to have some eligibility requirements, we'll deal with it, that just want one dose and be done.
Yeah, I think that's the biggest drawback. Because I was thinking, when you said sporting venues and things of that nature, if the state and other venues would require it, the Johnson & Johnson would be the best for that age group, so they can just get it and be done. But we shall see. Great report. I appreciate it. Appreciate all the hard work. We have a committee reports, executive committee. I believe there's nothing. Finance.
Thank you. First order of business with finance is we have an approval of the minutes from the April 14th, 2021 meeting. Do I have a motion to approve?
So moved.
Thank you. Do I have a second?
Second.
Thank you. All in favor signify by saying aye.
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 Opposed? Okay, minutes are passed. In item 2, the financial statements, A through D, that information was just gotten recently. I did not receive it in my packet, so I'm going to turn those bits over to Jim Keeler, and he will run through those with us. Thank you, Jim.
Okay, yeah, I'll share my screen here.
Page will be beyond.
I think he's trying to share his screen, but nothing is. Showing.
It looks like it should work. Try sharing again.
There you go.
Oh, it's coming.
Yeah.
Okay, I can see it.
It's working. But you're muted.
Hear me now?
Yes.
Okay,
Yes.
all right. I somehow get an electronic frog in my throat every once in a while. I don't know what happens here, but the monthly expenditures for the month of March were 977,878.85. So
Motion to approve.
Second.
All in favor to approve the expenditures and incurred in the month of March 2021, signify by saying aye.
Aye.
Opposed? So passed. Thank you, Jim.
okay, I'll move on to the statement of fund balance here. And I'll just kind of maybe go over the recap. We have all the monthly items there, but we began the year with a fund balance of $10,733,443. We had year-to-date revenues for the first 6 months of $5,431,244.67, and then a total year-to-date disbursements of $6,081,209.26, leaving a ending balance of fund balance of $10,083,435.84. So we've had a decrease over the year of almost 650,000. If you'll recall, last month we were, at a negative position of $1,250,000. So we have cut into that quite a bit. So I will. There's no questions. I'll move on. And this is our financial review, because we're actually now halfway through the fiscal year for the County of Winnebago and 3/4 of the year through our state fiscal year 2021. So yeah, time flies. So our revenue budget was for half a year is $7,191,741.12. We had the same actual revenues of $5,431,244.67 with a variance of $1,760,496. For expenses, our budget was $7,163,433.25, and our actual and encumbered expenses are $6,081,209.26 with a variance of $1,082,224. So there's no more questions on this. I'll move on. This is the balance sheet as of March 31st, 2021. And you'll see I have a couple of asterisks there, which is our accounts receivable and our deferred revenue. That's kind of referenced in a later schedule, but that's essentially all the items due that we haven't been paid for yet. And then the deferred revenue are two grants, which is the vaccination grant, which we just got, which was a prepayment of $725,000, and then our local health protection grant, they have a prepayment of roughly $450,000 that they pay in advance. And so as we earn it, we work that number down to zero. So I'll move on here to, these are expenditures, revenue and expenditures in detail. And the asterisk here is food service permits. We had a budget here of 600,000. And to date, we've only had revenues for the first 6 months of 65,000. And the reason for that is we have this, the abatement program through the county where we're going to be reimbursed. And so essentially, last year at this time, we had revenues of 276,000. So in food service permits only. So my point is, if all things had been equal and we didn't have a but we do have money coming from the county. The official amount, at this point, we're a couple $100,000 in arrears of revenues that normally we would get. So I guess the point I'm really trying to drive is, well, you know, we're in a negative position. We aren't necessarily in trouble. I mean, we have our challenges, but we're doing okay. So it's not a systemic loss situation that we're in. So, and then here on the bottom is the same numbers for year to date, 5,431,000 in revenues, middle of the page, and then the expenses of 6,081,000. So, and then this is the month to date, which was quite a bit higher because we post our quarterly real estate taxes, so it kind of skews every quarter a little higher. But we're in a true position now here of, you know, after 6 months of a deficit of, you know, essentially 250,000. And you can attribute that to Qualtrics purchase and shorting of our food service permits at this point. So I think we're progressing along pretty well. So there's no questions. I'll move on. Here is, well, I think that's I'm kind of moving through the other items here. This is the emergency reserve minimum graph, and in March we're like near 8.3 million in cash for 2021, which was higher than last year, well above the minimum. So we're doing of accounts receivable for our major grant programs, which total to $1,152,367.60 with on our balance sheet. And then these other two programs, we had advances of $725,000 for the population vaccination program.
Jim, I think you went quiet again. No, I can't hear you. No, I still can't hear you.
I'm getting his audio very low. I don't know if anybody else is.
Right. No, I agree.
Very
Yeah,
difficult.
it's very, very quiet.
All right, can you hear me now?
Yeah, but it's still quiet. Did you hit
Barely.
the volume button?
Yeah, Jim, pull up your volume a little bit.
No, all the way.
All right. Does that help? I know mine's louder, but
A little.
We're hearing you a little bit better.
all right. Okay, well, this is the final schedule. Here is our schedule of accounts receivable. And that's the various programs by month, and it's all been brought up to date as of the end of March. And then the bottom two are programs where we've had cash advances, which we're working off. So essentially, that's receivable. Are there any questions at all, or?
All
No,
right.
okay,
Jim, thank you very much.
all right.
We will move into we will move back to E, which is the bank reconciliations for March 2021. First one being the general account, which we have 258, 429.90 with the transfer in progress from our ePay of 571, 743.16, leaving us a balance in our general account of 827, 459.06. Lead account E2, we have a balance of $87,023.87. That is a drop of about $90,000 from the end of February's balance. The abandoned properties, we have gone back to our minimum account balance of $5,000. Is everyone still there? I lost video for a moment. We are back to about $5,000 minimum balance, which is about $25,000 less than in comparison with the February end of month. Our final E4 is our ePay, which we had a balance of 834, 452.63. We have a transfer in progress to our initial general account of the 571, 743.16, as well as deposits and transfer credits to earnings not posted yet, and which brings us to an account balance of approximately 271,903.22. In ePay, decrease of about $550,000, $571,000, which was a transfer to the general account. Does anyone have any questions concerning the bank reconciliations? Thank you. We will move to proposed contracts and agreements. The following proposed contracts and agreements were recommended for approval by the Finance Committee. They are items 4A through M. Can look through those, but the.
Can I have a question? Did we skip 3? Did I miss 3?
Did we skip 3?
Yeah, we see.
I'm sorry, excuse me. Go back to major expenditure, which is 3A through I. The fee for electronic filing of death certificates all the way through the Liberty Tire Recycling drive proposal for June 5th of 2021. The Finance Committee recommended approval to the Board of Health. Do I have a motion for approval?
So moved.
Second.
Thank you. Is that a second?
That was a second.
Thank you. Do we have any questions concerning any of these major expenditures? If none, all in favor signify by saying aye.
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 Opposed?
Aye.
Major expenditures are passed. I'm sorry, now we will move to item 4. The committee recommended the approval of all the proposed contracts. Do I have a motion to approve?
Move to approve the advance, the contracts and agreements as listed.
Second.
Thank you. I have a motion and a second. Do we have any questions concerning any of these contracts? If none, all in favor signify by saying aye.
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 Opposed? So passed. The last item we have is the cost of living adjustment COLA that can be found on page 167. For information, this was brought before the board. This was something that we voted on last year during budget committee. If funds were available for a cost of living adjustment of 3%, it's mid-year, so it's a and funds are available. So the Finance Committee strongly recommended that the 3% increase be given to all employees of the Health Department. We did vote on this before. There is not a need to vote or okay, but we feel this is something important because of the work and the overtime and the effort that the entire department puts in each and every day, especially in light of the pandemic we are in the middle of.
Want a motion or what are we waiting for?
We need a motion, but if we would like to do a motion for the, I'm not sure how we would phrase it for the.
To implement the cost of living as budgeted.
Yes, but we don't need to because it was okay, was it not?
It was, and we just thought it was a good sign of support to the team that the Board of Health looked at it and then again advanced it forward with full support of the board to implement it.
And Patricia, I will
Make that motion.
Thank you. Do I have
And I will second
it. Thank you, Alan. We have a motion and a second to approve the cost of living increase for the Health Department. All in favor, signify by saying aye.
Aye.
Aye. Opposed? Thank you. So passed. Well deserved. And that is the end of the Finance Committee. Jim, thank you very much for your assistance with that.
Excellent. Thank you so much. Policy Committee.
First of all, I need a motion to approve our minutes from April 4th.
So moved. Second.
All right, thank you. Any corrections or discussion on the minutes? All those in favor?
Aye.
Aye.
Opposed? All right, second thing is there was a proposed agreement regarding the permit reinstatement for the backyard grill, and the committee voted against entering into the agreement. It wasn't needed, wasn't necessary, doesn't do anything, and it opens us up to negotiating agreements all over the place with various vendors that have been fined or taken action against because of their inability or because they didn't want to comply with requirements. So the committee has voted against that. I'm not sure what we need to do here unless somebody wants to go and discuss it, or I guess not. That's good. The next thing is an update on 12-220 Harbor Oaks variance. The update is nothing. They haven't come back to us yet, so there's nothing to inform you about. And then the last thing is a variance that the committee didn't have to discuss, so is coming to the board directly. And Todd, I think, is the best one to talk about it. But you got to put your microphone on.
All right, I see that. I'll turn on the microphone. Can everybody hear me?
Yeah.
Oh, yeah.
All right, good. In your packet, you should have at least have our response. It's the variance recommendation, R201-034253. It's in your packet. And the reason for the petition is a property owner at 6148 Elevator Road wants to install a new well at that property where there's public water available. And that's provided by North Park Water. It's an EPA regulated water system that serves most of basically all of McChesney Park and a lot of Roscoe. In the background, that's basically what the background is, but I just wanted to emphasize in the code, section 86-111A, it basically says that when there's public water supply main is within 200 feet, is measured along a right of way or existing easement, the property line of the proposed to be served by a private well. No permit for such a well should be issued on the property. So it states it right there. When public water is within 200 feet, we do not issue a permit. And the reason why this is new construction for the whole board is because This property is existing. There is a house on the property, but it's being, they share a well next door. So there's never been a well on this property. It's actually next door. It crosses property lines. That's not allowed in our code either. But obviously that was established years and years ago, but in our current code, it's not allowed. If you recall, there was a precedent set on Bank Street a while back that we consider this stuff as new construction when there was never a well been put on the property. That's why it's being presented to the board. Okay, the staff recommendations, as you can see, is being for denial. I've been in contact with the owner about that. And truly the reason for that denial, as stated in the bullet points, the bids weren't detailed, and I can bring that up. I'm not a techie here, as everybody knows. Let me see what I can do here. I would like to bring up screen 3. Why is it?
Share your screen.
Oh, well, wait a minute. Hold on. Whoops. Let me do that again. Screen 3.
Mm-hmm.
All right. Does everybody see it? I'll bring up a picture first for everybody. Can everybody see it?
You're doing great.
All right. Thank God. All right. As you can see, the red boundary is the property. Below Elevator Road, which is labeled, there's a blue line. That's the main. So as you can see, it's just on the other side of the road, so it's within 200 feet. All right, just wanted to give so if there's a visual on it, they would have to dig through. As you can see my hand, they would have to directly bore underneath the road and then run it up to the house, the city water. The existing well is on this property that I'm right here. This is where the original well for this house. Obviously, there is no well on this property. That's why he's proposing to drill a well on this property. Okay. So
Pat,
coming back, yep.
Why is he proposing it at this time?
For financial hardship. Now,
Well,
I got bids, and I'll bring them up real quickly, and I apologize, this was introduced here. Real quickly here is a first bid, as you can see, was basically $9,300 for the digging into the house. And the underline bore of the road is $17,000. So we're talking $26,000 that bid was. And I'm going to have some more information about all of these bids because I don't think they're very clear. And I'll point these out. But that was $26,000 for the plumber to hook it into the house, and the directional bore underneath the road is $17,000. So $26,000. The next one, if you could just give me a minute, the next one, sorry it takes so much time, is from Pearson Plumbing. This one was only to directional bore underneath the road all the way to the house, $23,000. So it's a little cheaper. On this bid is $23,000. Is to go underneath the road, under board, all the way to the house. But I do have I want to point out something on this bid.
Todd, overall, why are they selling the property?
They are selling the property. That's what they're doing. It does say on here, this is what's confusing. I'll point this out. Staying next to the driveway to stay approximately 25 feet away from the septic system. The septic's up front. Please keep that in mind for $23,000. So they're saying they're not digging in the driveway at all. They're running along the driveway, but maintaining 25 feet from the septic, which is code, the water line. We can, the exact, oops, not that one. Please, where's the other one?
It's okay. No,
there's just so much here. That's the same one.
no, I think you had the right one. Yeah, go away.
Yeah, number 3 is what you
There
want.
you go. There you go.
There's one for 18,000. They were directly boring underneath. So that doesn't seem to be, so there's a big cost difference with that one. From the 26,000 to 23,000. But the biggest one was, is this one from that Pearson. That was 23,000 for just for them to. So I wanted to know what it cost to bore underneath the road and then dig it, trench it all the way to the house. I thought it would be cheaper. It's more money. But now they're saying they can't go along the driveway. They got to dig through the driveway. That's why there's more money. So there's a conflict between these bids with one of the plumbers. I don't understand that. I do feel that there is, I think there needs to be more clarification on these bids or possibly go for a bid ourselves on this.
Todd? No.
I have 2 questions. First of all, my question is, do they have room and will it be far enough from the septic to dig a new well?
Yeah, that's, where's the septic? Yeah, I wanted to see where it was in relation to the property.
This is the relay. Here's the property. A septic contractor put this together. When I asked him if this is official, he said no. So that was one of the bullet points on the reasoning why we're denying it. Because the location of the septic is currently unknown. We do not know exactly where this septic.
And do we have any diagrams ourselves in the files to indicate where it's?
No, we do not. It's too old. So the reason for these bullet points, and the main bullet point is, from the best of my knowledge, in looking through all the records and the 25 years and all that, we have never allowed hookup when there's city water available for new construction.
Well, I guess
First of all, a septic man can go out there and find all that and draw it out for you.
That is correct.
So even you don't have, they can do that. They do it all the time.
Yes. So he was not, obviously the owner was not willing to pay a septic contractor. That was just a guess from the septic contractor that I showed you. So there's no official map showing the exact location of that septic.
Now, Todd, do they own both parcels of property?
Yes, they do. Now, I did check out the deed to see if there was anything on the deed. He did provide me. There is absolutely nothing on either deed of either property with that sharing that well. Sometimes they do have legal on the deed saying if they had to split the property or stop sharing the well, there's always something on the deed, but not on this one. There's absolutely nothing legally on the deed.
Todd, do we have a value of the property that he is selling?
Yes, the assessment value, which is $86,000 that he provided us through the tax assessment. Now, obviously, we did some research through some social platforms here, such as Willow and all that. It was suggested price that was on sale at one time was $240,000, that property.
That's just the one that he's selling, not the combined.
Not to combine.
Yes, thank you.
$240,000. So I feel that's why we put these staff recommendations, but there's a lot of information that I still do not know. The location of the septics. Why is there discrepancy between these two bids by one plumber? And obviously, we always have the right to get our own bid. Now, here's the bid for to drill the well. Remember, the lowest one that I presented was for $18,000. Now, the bid to drill a new well, it's at $9,300. So So it's basically double the cost to hook up to city water.
Todd, it seems to me from previous discussions we've had concerning variances in water connection and sewer connection, the other half of the property can then hook up to that water at a lesser cost. So it's kind of distributed out, is it not?
Great question. Yes, it is. You value, once it crosses the road of Elevator Road to get it on the north side of that road, that's most of the cost. Remember, that cost was 17,000 just to get underneath the road. Once that is, you can connect both houses. That is true by one owner.
Ron, do you need a motion to,
I need a motion to do something. I mean, since I'm chairing this part, I can't make the motion, but
I make a motion to approve the recommendations by environmental and policy committee to deny the request for the drilling of the well.
I'll second.
okay, just to clarify, the committee never looked at this request because it wasn't submitted in time.
Oh,
But I would suggest that probably the committee would channel its inner Steve Lidval and say that we would agree with your motion, John.
I think we would need a more convincing case in
Yes.
order to not do exactly what you're saying, Ron.
Mhm. Any other discussion? Yes.
I have to
I'd
agree
like
with
to
Pat.
say I apologize about the timing of this variance. There was an internal issue that has been addressed with one of my staff members. So
No, that's no problem, Tom. It's Todd. That's fine. Angie, were you gonna say something?
I agree with Pat. We need to have a lot more information on this. And we probably should even do our own investigation of what the price would cost. The other thing is we would also have to find out, is it possible to put a well on that property without interfering with the septic? And I think you were kind of on it, Ron, when you said about if that water goes in there. Probably, has anyone talked to the other owner of the other piece of property to see if they would like to share in the cost and have their home hooked up to North Park Water?
The same owner.
that's the same owner, but yes, they would both properties would benefit. And
Is that the problem is if he goes to sell the other property and it's still on the shared well, he still has the same problem. He hasn't solved his problem. He's killing two birds with one stone if he puts it all in at one time. And the split between both properties, when he goes to even file taxes, he has a deduction there that'll help him. But since he owns both properties, he must have one as a rental, I'm assuming.
Mhm.
And he can take quite a bit off on, in fact, not even just 1 year, it might even take a couple of years. And he could split the cost between the two houses. You know, he really needs to dig into this more, because when he goes to sell the other house, he's going to have the same problem.
Well, maybe if we pass this motion, it will encourage him to look into it further.
I was going to say that why I feel more information may be needed. It's not necessarily needed by the Board of Health because of Well Code Section 86111A. So.
Right.
And just
Any
always
other-
remember, just adding a public utility does add, the price of your property. It goes up another $5,000. That's what the current, a real estate association says. So.
Todd, you
How do
can
you-
stop
How do you get
sharing.
another well?
Even outside of the, like the bids and everything and not knowing, do we have anything to even say that a well could be drilled in soil sample and that depths and things on the property?
Yes, the property is large, is big enough to make the separation of 100 feet from a septic where it's how can I say,
It's estimated.
Knowing exactly where that well is at. I mean, where that septic is at.
And how old is that septic, Todd?
Oh, it's got to be prior to 1975.
Yeah, okay, we got another issue there.
So we have nothing on file.
We have no backup septic field, correct?
We do not know exactly where it's at. The septic, yes, we do not know.
Any other discussion on the motion? So the motion is to deny the variance request. All those in favor?
Aye.
Aye.
Opposed? That's it for policy.
Thank you, everybody.
Thank you. There's no meeting for personnel and quality, and Dr. Martell needs to bring up the Northern Illinois Public Health Consortium issue with pending House bills, House Bill 2615 and Senate Bill 2007.
That was just a copy of correspondence. Sorry.
Oh, but I have a question.
Sure.
One, who's proposing this? And two, have they never heard of botulism and food poisoning? Because am I reading this right, that they want people to be able to just make canned foods at home and sell them throughout the state and across state lines?
Yes.
With no regulation, supervision, inspection, nothing.
Pretty much minimal. Yes.
So we don't know if they're washing their hands, if they have water, if it's close to
Correct.
animals, feces, what the structure looks like, but we're going to let them sell this publicly.
Yes, and it passed out of, so as the president of Northern Illinois Public Health Consortium, we put together, obviously we spoke and gave Senate testimony on this one. And we're balancing against, because of people coming out of first of all, the pandemic response and cottage industry in general, trying to make, we understand the need to make living and, kind of try, but the two items that were particularly troubling, and Todd and I reviewed a lot of the part, has to do with the canning. And again, especially when we get into fermentation and when we get into low acid foods, which were some of the items that were being added to this particular legislation. Now, it did pass out of the Senate, regardless of what public health recommendations were from the entire public health community. The next step will be fighting in the Rules Committee to tighten up any kind of rules on that. I think, the whole opening of internet sales and being able to creates when you talk about some of these, preserving processes for long-term storage. So how many of us have gone into an older relative's home, right, and found a can of something that someone canned or something, and you're like, yeah, no. We really need to put some regulation around some of this. And I think the other equity issue and concern is that we have local restaurants and businesses that do it as part of their, business, and they have to comply with, different regulations and labeling requirements and safe food handling. But we'll see what comes out of the rules section. But there was just definitely the argument was more in favor of the farm to table movement and the individuals being able to produce home goods and be able to sell that to make some, money during times when the economy was shut down. So
I understand that completely, but I'm looking at all the people whose names are attached to this, and it's every major county health department, and it crosses political spectrum, the counties. I mean, I'm stunned that this even made it out of a committee of people, because you have to ask yourself, would you feed your child this food, knowing that it wasn't up to, held to any type of code or standard?
I guess the idea is that if they wear a mask, it's okay to poison us.
Oh, but it's organic. Think
not-
about it.
Yeah, it's not the question of if, it's when it's going to happen.
Oh, it's not the question, but that's how it'll be put on the market.
And interestingly enough, I mean, while botulism is extreme, two of the major outbreaks that have occurred, really occurred within the last 5 years, was an outbreak in Mississippi associated with fermentation of grain, otherwise known as some kind of grain alcohol. that was canned and preserved that created a botulism that sickened and actually killed individuals. And another person was creatively in the city of New York related to frozen peas. Their freezer went bad and they decided to can their peas. They were very economical and resulted in case of botulism. Because again, these are low acid foods. They require that high pressure canning. Most individuals nowadays don't do that kind of work. And so again, what are the procedures in place? So there are modern day cases in larger urban areas where people have inappropriately canned items and sold it to neighbors, friends, and relatives and to people down the street and had an issue. So as the health department, not only do we have the prevention piece, we also have the response piece, right? So this, I don't think people understand a case of botulism, one case, even suspicion of it requires activation of a strategic national stockpile. We have to activate, then we have to pick that up at O'Hare at all hours to bring that, start the infusions. Because again, these are life-threatening events. And I come back to, we really have to not lose track on some of these major public health, protective, pieces. I understand this pandemic has challenged everyone, the concept and the role of government, but very concerning. I did talk to Senator Stottlemyre today, and he's going to very much advocate for that it goes into the rules that they have to get with us at the table. So in JCAR, when we issue appropriate rules on this, that's the best we can do at this point, but it is concerning.
All right, well, thank you. We'll keep abreast because I have a feeling if it's not greatly amended, this is going to come back and be a huge problem throughout the state, not only in our county. Joyous.
Not if it's one.
All right, so I don't see any more business. Do we need an executive session?
No, we do not.
Okay, then I need a
I
motion for
move we
adjournment.
adjourn.
Second. All in
Second.
favor?
Aye.
Thank you all, and I don't recommend buying any canned foods over the internet.
Thank you, everyone. Have a great evening.
Thank you, doctor.
Good night.